Today, let's talk of angina or angina pectoris. The definition, history, pathophysiology, types, risk factors, symptoms, diagnosis and tests, and treatment and drugs. Angina is chest pain, discomfort, or tightness that occurs when an area of the heart muscle receives decreased blood oxygen supply. It is not a disease itself, but rather a likely symptom of coronary artery disease, the most common type of heart disease. The lack of oxygen-rich blood to the heart is usually as a result of narrow coronary arteries due to plaque buildup, a condition called atherosclerosis. This condition was named by hritshoola in ancient Indian and was described by Sushruta, 16th century BC. Pathophysiology. Angina is caused by reduced blood flow to your heart muscle. Your blood carries oxygen, which your heart muscle needs to survive. When your heart muscle is not getting enough oxygen, it causes a condition called ischemia. The most common cause of reduced blood flow to your heart muscle is coronary artery disease, CAD. Your heart coronary arteries can become narrowed by a deposit called plaques. This is called atherosclerosis. The reduced blood flow is a problem, it's a supply problem if your heart is not getting enough oxygen-rich blood. You may wonder why you don't always have angina if your heart arteries are narrowed due to fatty buildup. This is because during time of low oxygen demand, when you are resting, for example, your heart muscle may be able to get on by the reduced amount of blood flow without triggering angina symptoms. But when you increase the demand of oxygen, such as exercising, this causes angina. Types of angina: stable angina or chronic angina. Stable angina is usually triggered by physical exertion. When you climb stairs, exercise, or walk, your heart demands more blood, but it is harder for the muscle to get enough blood when your arteries are narrowed. Besides physical exercise, other factors such as emotional stress, cold temperatures, heavy meals, and smoking also can narrow arteries and trigger angina. Unstable angina does not follow a regular pattern. It can occur when at rest and is considered less common and more serious because rest and medication does not relieve it. This version can signal a future heart attack within a short time, hours or weeks. Variant and microvascular angina are rare and can occur at rest without any underlying coronary artery disease. This angina is usually due to abnormal narrowing or relaxation, spasm of blood vessels, reducing blood flow to the heart. It is relieved by medicine. Risk factors of angina. The following risk factors increase your risk of coronary artery disease and angina. 1. Tobacco use. Chewing tobacco, smoking, and long-term exposure to second-hand smoke damage the interior walls of arteries, including arteries to your heart, allowing deposit of cholesterol to collect and block blood flow. 2. Diabetes. Diabetes is inability of your body to produce enough insulin or response to insulin properly. Insulin, a hormone secreted by your pancreas, allows your body to use glucose, which is a form of sugar from foods. Diabetes increases the risk of coronary artery disease, which leads to angina and heart attacks by speeding up atherosclerosis. 3. High blood pressure. Blood pressure is determined by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. Over time, high blood pressure damages arteries. 4. High blood cholesterol or triglyceride levels. Cholesterol is a major part of the deposit that can narrow arteries throughout your body, including those that supplies your heart. A high level of the wrong kinds of cholesterol, known as low-density lipoproteins (LDL), cholesterol. The bad cholesterol increase your risk of angina and heart attacks. A high level of triglycerides, a type of blood fat related to your diet, also is undesirable. 5. History of heart disease. If you have had coronary artery disease or if you have had a heart attack, you are at a greater risk of developing angina. 6. Old age. 7. Lack of exercise. An inactive lifestyle contributes to high cholesterol, high blood pressure, type 2 diabetes, and obesity. However, it is important to talk with your doctor before starting an exercise program. 8. Obesity. Obesity raises the risk of angina and heart disease because it is associated with high blood cholesterol levels, high blood pressure, and diabetes. Also, your heart has to work harder to supply blood to the excess tissues. 9. Stress. Stress can increase your risk of angina and heart attacks. Too much stress, as well as anger, can also raise your blood pressure. Sugars of hormones produced during stress can narrow your arteries and worsen angina. Causes of angina. Angina is usually caused by coronary artery disease when the arteries that supplies your heart muscle with blood and oxygen become narrowed. The blood supply to your heart muscle is restricted. This can cause the symptoms of angina. The symptoms are often brought on by physical activity and emotional upset, cold weather, or after a meal. The episodes usually subside after a few minutes. Symptoms associated with angina are 1. Chest pain or discomfort. 2. Pain in your arms, neck, jaw, shoulder, or back accompanying chest pain. 3. Nausea. 4. Fatigue. 5. Shortness of breath. 6. Sweating. 7. Dizziness. 8. Vomiting. The chest pain and discomfort common with angina may be described as pressure, squeezing, fullness, or pain in the center of your chest. Some people with angina symptoms describe it as feeling like a vice is squeezing their chest, or pain like a heavy weight has been placed on their chest. For others, it may feel like indigestion. Diagnosis and tests. A correct diagnosis for chest pain is important because it can predict the likelihood of having a heart attack. The process will start with a physical exam as well as a discussing of symptoms, risk factors, and family medical history. A physician who is suspicious of angina will order one or more of the following tests. 1. Electrocardiogram (EKG) records electrical activity of the heart and can predict when the heart is starved of oxygen. 2. Stress test, blood pressure reading, and an EKG while the patient is increasing physical activity. 3. Chest X-ray to see structures inside the chest. 4. Coronary angiography, dye and special X-ray to show the inside of coronary arteries. Dye is inserted using cardiac catheterization. 5. Blood tests to check levels of fat, cholesterol, sugar, and protein such as myoglobin and troponin. Prevention of angina. Unfortunately, you can't reverse coronary artery disease, which causes angina, but you can help delay your arteries narrowing. To do this, it is important to stop smoking, control high blood pressure, reduce your cholesterol level, be physically active, achieve and maintain a healthy weight, control your blood glucose if you have diabetes, eat a healthy diet, and only drink moderate amount of alcohol. Treatment and drugs. Lifestyle changes. If your angina is mild, lifestyle changes may be all you need to do. Even if your angina is severe, making lifestyle changes can still help. These changes include the following. If you smoke, stop smoking. Avoid exposure to second smoke. If you are overweight, Talk to your doctor about weight loss options. If you have diabetes, make sure that it is well controlled and that you are following an optional diet and exercise plan. Because angina is often brought on by exertion, it is helpful to pace yourself and take rest breaks. Medications. If lifestyle changes alone don't help your angina, you may need to take medications. This may include 1. Nitrates. Nitrates are often used to treat angina. Nitrates relax and widen your blood vessels, allowing more blood to flow to your heart muscle. You might take a nitrate when you have angina-related chest discomfort before doing something that normally triggers angina, such as physical exertion or a long-term preventive basis. The most common form of nitrates used to treat angina is with nitroglycerin tablets put under your tongue. 2. Aspirin. Aspirin reduces the ability of your blood to clot, making it easier for blood to flow through narrowed heart arteries, preventing blood clots, and can also reduce your risk of a heart attack. But don't start taking a daily aspirin without talking to your doctor first. 3. Clot preventive drugs. Certain medications such as clopidogrel can help prevent blood clot from forming by making your blood platelets less likely to stick together. 4. Beta blockers. Beta blockers work by blocking the effects of the hormone epinephrine, also known as adrenaline. As a result, the heart beats more slowly and with less force, thereby reducing blood pressure. Beta blockers also help blood vessels relax and open up to improve blood flow, thus reducing or preventing angina. 5. Statins. Statins are drugs used to lower blood cholesterol. They work by blocking a substance your blood needs to make cholesterol. They may also help your body to absorb cholesterol that has accumulated in plaques in your artery walls, helping prevent further blockage in your blood vessels. Statins also have many other beneficial effects on your heart arteries. 6. Calcium channel blockers. Calcium channel blockers, also called calcium antagonists, relax and widen blood vessels by affecting the muscle cells and the arterial walls. This increases blood flow in your heart, reducing or preventing angina. Medical procedures and surgery. Lifestyle changes and medications are frequently used to treat severe angina, but procedures such as angioplasty, stenting, and coronary artery bypass surgery also are used to treat angina. Number 1. Angioplasty and stenting. During angioplasty, also called percutaneous coronary intervention (PCI), a thin balloon is inserted into your narrowed artery. The balloon is inflated to widen the artery, and then a small wire mesh coil stent is usually inserted to keep the artery open. This procedure improves blood flow in your heart, reducing or eliminating angina. Angioplasty and stenting is a good treatment option if you have unstable angina or if lifestyle changes and medication don't effectively treat your chronic stable angina. 2. Coronary artery bypass surgery. During coronary artery bypass surgery, a vein or artery from somewhere else in your body is used to bypass a blocked or narrow heart artery. Bypass surgery increases blood flow to your heart and reduces or eliminates angina. It is a treatment option for both unstable angina and stable angina that has not responded to other treatment. If you haven't subscribed yet, please subscribe, turn on notification bell